I'm Tony. Do you think you can give me an SBAR report on your patient?
Yeah, the patient's Marta Yarn. She's admitted today, is an 80-year-old female in room 529. She has no known allergies and is a full code. Cytorals are up ×2 for safety reasons, and she's a fall risk. Her primary diagnosis is a non-healing stage 3 pressure ulcer of 3 months and was treated as an outpatient without success. She was admitted from her primary care physician, Dr. Jolly. She's had multiple admissions in the past for dehydration and pneumonia. She was last admitted 6 months ago and does not smoke, no history of heart disease or chronic illness. At 14:15, it was reported that she had a 6 out of 10 sharp pain and was given Percocet to alleviate that pain. She is learn-oriented ×3 with Perla, steady gait and ambulates with a walker. She's cooperative, has anxiety, and has equal chest expansion with clear auscultations, diminished basis with a non-productive cough. Room air was at 92%. Normal sinus rhythm was recorded with a regular apical pulse, no murmur. Pulses are 2+ with a capillary refill of less than 3 seconds. The abdomen was soft palpation, non-tender with non-distension. Bowel sounds were active in all 4 quadrants. The last bowel movement was recorded on Tuesday. Regular diet will be NPR at midnight due to debridement surgery tomorrow morning. Self-voider with amber-colored urine. Her last intake was recorded at PO 850 milliliters and output was 350 milliliters voided. She's pending a wound and dietary consult with chest x-ray. Blood cultures came back positive for E. coli, which is why she's getting antibiotic, gentamicin, 80 milligrams per 100 milliliters over 1 hour, Q8 hours. She has a right dorsal metacarpal IV in her right forearm and is receiving 0.9% normal saline with 20 milliequivalents of potassium chloride at 125 milliliters per hour continuously. Elevated white blood cell count was recorded at 12.5, which is why she's getting the antibiotic. The time of vitals was 14:15 with a temperature of 99.1, heart rate of 88, O2 saturation of 92% with a blood pressure of 144/90.
Why specifically is the client receiving this medication?
The patient's blood culture and sensitivity came back positive for gram-negative E. coli.
What action does the medication have on the body?
This medication inhibits synthesis in bacteria at level 30's ribosome.
When should you question administering this medication?
If the patient has been taking penicillins or cephalosporins, which deactivate the antibiotic, if the patient also has a sensitivity of aminoglycosides.
Does the medication have a therapeutic serum level?
This medication has a therapeutic serum level of 5 to 10 micrograms per milliliter of the patient's blood and becomes toxic at 12 micrograms per milliliter.
Which vital signs must be monitored?
All vital signs should be monitored, but elevated temperature would indicate a fever, elevated blood pressure, respirations, and heart rate would indicate discomfort or distress.
Which physiological parameters should be monitored when the medication is being administered?
Physiological parameters should be monitored are signs of ototoxicity, ringing in the ears, nephrotoxicity, ataxia, or muscle paralysis. Also, you would look for signs of infiltration through the IV, such as redness, swelling, or bruising.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
To report any discomfort they may be feeling even at the IV site or any adverse reactions that may be from the medications.
What interventions must be taught for taking the medication safely at home?
They will most likely not be receiving IV medications outside of the hospital setting and may be transitioned to oral antibiotics. They should be taught to take all of the prescribed meds until it all runs out to avoid bacterial resistance and reinfection.
What are the side effects and potential adverse reactions?
Ataxia, vertigo, ototoxicity, nephrotoxicity, diarrhea, vomiting, muscle paralysis, and apnea.
How will you know the medication is effective?
You'll know the medication is effective when the patient's blood culture comes back negative for E. coli and the white blood cell count comes back as normal range. All right, so is that it?
Mm-hmm.
All right, we're going to go ahead and meet the patient. So I'm going to knock on the door. Knock, knock. I'm going to wash my hands. All right. Hello, Mrs. Yarn. My name's Trevor. I'll be your nurse for today. This is Tony Martin. She's a level 1 nursing student. Is it okay if she observes for a second?
Yes, that's fine.
Okay, can you go ahead and tell me your name and date of birth?
It's Marta Yarn.
And how old are you?
I'm 80 years old.
Okay, and can you tell me, do you have any allergies?
No.
Okay. Why we're here is we're pretty much here to administer antibiotic. Your white blood cell count came back elevated at 12.5, so your doctor went ahead and put in the order for some normal saline with some potassium chloride and an antibiotic, gentamicin, okay?
Okay.
So I'm going to go ahead and access my MAR here. All right, and one more time, I just want to match with the, reinforce with the MAR. Can you tell me your name?
Marta Yarn.
Okay, and can you tell me how old you are?
I'm 80 years old.
All right, Mrs. Yarn, and can you tell me, do you have any allergies?
No.
Okay, I'm going to go ahead and confirm that in the MAR, which is yes, that is correct. You have no allergies. Okay, I'm going to go ahead and access my MAR. I'm going to see the medications here. I'm going to go ahead and pull them. I have the sodium chloride and I have the antibiotic, gentamicin. So I'm going to go ahead and individually check each one. We'll start off with the normal saline first. I'm going to make sure it's the right med, correct, the right route in the arm, yes, the right patient. Can you tell me your name one more time?
Marta Yarn.
Okay, and the right dose I know is confirmed here. Yep, the time, correct. I'm going to go ahead and check the clarity now, which is good. The expiration date and the label matches MAR. Good. I'm going to go ahead and do that for the second one. I have the antibiotic here, the right medication, correct, the right route, yes, the right patient. Can you tell me your name one more time?
Marta Yarn.
Okay, the right dose, yes, and the right time. And the clarity, good, and the expiration date, yep, and the label is good. So now that I have all my 5 rights for both medications, all the safety measures have been checked, I'm going to go ahead and get my med book, just to make sure that they can be mixed and don't need to be given with food or anything like that. So first I'm going to look for my sodium chloride. Okay, you see in the book right here? Okay, and now the antibiotic right here. You see that there? Okay, now I'm also gonna, we can go ahead and call the pharmacist to reinforce our knowledge, make sure that everything's safely administered. Okay, so now that we have that, we're going to go ahead and bring these over here. All right, Mrs. Yarn, I just pulled the medication, the gentamicin that I mentioned earlier. It's an antibiotic because, like I said before, your white blood cell count came back elevated at 12.5. It did show E. coli was found in your blood. I want to reinforce the fact that you do have the right to refuse. Okay, do you refuse at all?
No.
Okay. If you have any additional questions at all, I have a brochure for you that you can review. It has some additional information that you can refer to, okay?
Okay.
But if I could just go over some side effects with you, you want to look out for ataxia, diarrhea, vomiting, apnea, and muscle paralysis. So if you feel anything like that, just let me know, okay?
Okay.
All right, so I'm going to go ahead and put my drugs here in my computer. I'm going to have my scanner here. I'm going to go ahead and boop. Boop. All right, and then one more time, boop. Boop. Okay, and you can see it does pop up on the computer here. In the event that the scanners don't work, we're going to go ahead and type it into the computer manually, which is what we'll do now. So we're going to set up the codes in the computer. First, I'm going to start with the sodium chloride. Okay. Type that in here. Okay, so I have the patient ID and the medication barcode there. If you want to go ahead and confirm that I do have the green light, I'm good to go for the sodium chloride with potassium chloride. All right, and so now I'm going to, I just want to record the site, which is the right Okay, now I don't want to put anything else such as the time or the initials or comments about it. I want to save until I go ahead and actually do that. So I'm gonna go ahead and bring my medications here. Okay. Alright, so I'm gonna go ahead and wash my hands. I'm gonna put my gloves on. Okay. I want to be very careful that I keep sterile procedure. I want to make sure that the patient is safe, okay? So I'm going to go ahead and get my flush here, my alcohol pad. I'm going to go ahead, Mrs. Yarn, I'm going to make sure that your IV is nice and patent. I'm going to make sure that I'm going to flush it to make sure that it's okay.
Okay.
I'm going to go ahead and keeping sterile procedure for about 15 seconds. Okay. And now I'm going to take my cap off of my flush. I'm going to make sure that everything's sterile, doesn't touch anything. And what you're going to look out for any signs of discomfort, just let me know. I don't see any signs of redness or swelling. So,
Okay.
all right, and that's flush. Everything looked perfect. Did you feel any discomfort at all or anything?
No.
Okay, so I'm going to go ahead and throw that away. Now I'm going to have my sodium chloride here. Okay. I want to make sure that all my ports don't ever touch the ground. Everything's nice and sterile. Okay. So I have this here. I'm going to go ahead. Okay. I'm going to uncap that. I'm going to go ahead and get my cap off my plunger there. So everything's nice and safe. I'm going to make sure it gets in all the way. Okay. All right. So I'm going to go ahead and hang this. All right, like so. I'm going to make sure to squeeze to get to that nice and that midline here. Okay. I'm gonna get my Dilaflow here. All right, and I'm gonna make sure that everything's sterile. And take my cap off. Okay. Alright. See, everything's good. Everything's locked. I'm going to make sure that everything is under sterile procedure. I'm going to go ahead and, now that I have it hooked up to my Dilaflow, make sure that everything's clamped and locked and everything's sterile. I'm going to go ahead and wipe them. I'm going to make sure that I'm going to actually go ahead and prime this. So, okay. Okay. So it's clamped. Now I'm going to make sure that everything's primed. I got this to the nice midline level. I want to make sure that there's no bubbles. I'm going to go ahead and prime my tubing. All and it's flowing nicely. Okay, as you can see, there's no bubbles or anything of that nature. Okay, so there we go. Now I'm going to go ahead and hook it up to the patient and get my alcohol pad, keeping sterile procedure. Okay, throw that away. Again for about 15 seconds. Okay, 15 seconds. I'm going to go ahead and clamp that on. Okay. Now once I have it clamped on here, I want to make sure that I set it for 125 milliliters. Okay, so you can see 125 milliliters. Okay, and then I'm going to unclamp it. All right. Now I'm going to wait for my 5 drops. There's 1, 2, 3, 4, 5. Okay, so that's going well. Mrs. Yarn, do you feel any signs of discomfort or anything like that?
No.
Okay. I'm going to go ahead and take my gloves off. Okay. All right, so I'm going to go ahead and save that information. I'm going to do the time. I'm going to chart that the patient stated 0 signs of discomfort during administration. I'm going to go ahead and initial that. Okay. Now I'm going to go ahead and access my gentamicin antibiotic and do the same exact thing, enter my patient ID and my medication barcode. So the patient ID 59409056552. The medication barcode D9CC BC5EC79BOD. Okay, so I do have that confirmed. If you want to go ahead and confirm that I do have the green light here. All right, perfect. We're gonna go ahead and so now I'm gonna go ahead and administer the medication and then go ahead and chart the details of it, so I don't do that in advance. So I'm gonna go ahead, get the green light. All right, I'm gonna go ahead and wash my hands. All right, get some gloves on here. Making sure to keep sterile procedure. Okay, so I have my antibiotic here, my secondary line. I want to make sure again that the ports don't touch the floor or anything of that nature. Okay, I'm going to undo my cap, throw that away. Cap. I'm going to make sure that my lines are locked so it doesn't spill everywhere. all the way through. Line is locked. I'm gonna go ahead and get up here. Okay, I'm gonna go ahead and undo my cap, throw it away. I want to get my thing here. I'm gonna alcohol swab the way. I'm gonna alcohol swab my port, keeping sterile procedure for 15 seconds. Okay, 15 seconds are up. I'm gonna go ahead and insert my antibiotic. Alright. And I'm gonna go ahead and inspect. I'm gonna go ahead and make sure that I have, wanna make sure that it's clamped all the way. Alright. I'm gonna go ahead and demonstrate the backflow. I'm gonna go ahead and actually lower my antibiotic. Okay, lower. I'm gonna make sure that I have backflow. As you can see, I have the air bubbles coming up so that I do have appropriate backflow. And then I'm gonna go ahead. Alright, perfect. Alright. Get that back up there. It's at the nice median level, so everything's running smoothly. I'm gonna go ahead, I'm gonna set my dial flow to 100 milliliters per hour, which I do right there. Okay. All right, I'm gonna go ahead and unclamp my antibiotic. Okay, and I'm gonna wait for the 5 drops. 1, 2, 3, 4, 5. All right, perfect. So that's running smoothly. Do you, Mrs. Yarn, do you feel any signs of discomfort or anything like that?
No.
Okay, very good. I'm gonna go ahead and take my gloves off. I'm gonna document that. All right. Minister time. The patient time. The patient reported 0 signs of discomfort during administration. All right. I'm going to initial that. I'm going to go ahead and save that now. One second. All right, so that's been saved into the computer, okay? So now I'm gonna go ahead and label my lines here. I'm gonna write I'm gonna write down my pen, my name, my initials, date, and time. Okay, do that. And then now for the other one, date, time. All right. Now, Mrs. Yarn, I'm going to go ahead and have you teach back to me what signs, what signs you would be looking for the medication.
Diarrhea, nausea, vomiting.
Okay, that's perfect. Yep. If you have any questions for me at all, just let me know. I'm going to go ahead and lower your bed, put the call light within reach. I'm going to go ahead and wash my hands, and we're actually going to come back in 1 hour to stop the piggyback and reset the normal saline at 125 on the diaphragm once the antibiotic runs out, okay?
Okay.
So we can go ahead and exit the room. All right, so I'm gonna wash my hands. All right, do my XYZs. The call I was in reach, bed was lowered. All right, so yeah, that went pretty well.
Were there any pertinent pieces of information that you reviewed before administering the client the medication?
Yep, I made sure to check the patient's allergies and the 5 rights of safe administration. I also checked to see what other meds the patient is on to avoid drug-to-drug interactions. It is also important to assess the IV site for patency and infiltration before the start of a medication to avoid complications.
Did this information affect your decision to administer the medication?
Yep, all of this determined whether or not I would administer the med. It could also be detrimental to the patient if I skipped any of those steps.
Did this information affect how you administered the medication?
Yes, I made sure to check the IV line and port for patency before the administration of the medication to prevent complications. All right, thank you.